HARTMANN's promise is to go further for health. Last April, 3 of our colleagues did just that by travelling more than 30,000 kilometres to the Potosí region in Bolivia for a 10-day volunteer mission. In collaboration with the CARE volunteer programme, they helped to build a health centre and provided education and training to local residents.
My arrival was really excited. I arrived in Cochabamba and my baggage was in Santa Cruz, so we have to drive to the airport 4 or 5 times, but finally I got it.
It took about 30 hours and 4 flights to get here, but once I finally arrived, I was welcomed by Bettina and we headed off into Cochabamba.
Given the altitude, the climate was also something to adapt to.
I've been struggling a little bit. I think when I'm climbing stairs or if I bend too quickly, then I get a little bit of short of breath.
And of course, the first impressions were also different from what the volunteers are familiar with back home.
Cochabamba is such a varied town. It's brought me back a lot to sort of my culture as a young child. I've seen a lot of things that have made me a little bit nostalgic. Es un alfajor.
Gracias.
The general perception is that Western medicine is far less common than traditional healing remedies.
I think the traditional healer is critical in the indigenous population here. Yeah. I think without them it's almost impossible to get the people to get the appropriate healthcare that's required. I think they're the integral communication link between the traditional and modern medicine, and I think having them involved and making sure that there's that connection is what's going to make the difference here in Bolivia.
The new health centre in Tarwachapi will provide basic medical care for 12 surrounding villages, which includes a lavatory, a pharmacy and maternal and dental care.
There's not enough resources here for the number of people that they have in the village. That's the good reason that together with CARE and HARTMANN in the partnership they're building this new health centre, and that will start providing a lot more space and certainly more resources for the local people.
Malnutrition is also a big problem.
The mothers were coming from the village and all over the places to wait and measure the children because of the malnutrition. The mothers are getting workshops about nutrition to improve their skills and to have a better nutrition for the children.
The volunteer programme was eye-opening and had many highlights. It proved to be a rewarding experience for everyone involved.
This has been a life-changing experience for me. I knew before I came that it would be, but maybe even more so than I thought it would be.
I think we've been part of something that's really special. No one can experience what we've experienced, no matter what we say or what we do, but it's important that people understand what the situation is like there.
I think we came here as colleagues and I think we're leaving as friends, and I think that's really special, and I hope that we stay in contact all the time.